Very good morning, students, and a warm welcome to the digital classroom of science. Students, we had already finished with the explanation and workbook exercise of the first lesson, but as I was having the last year's edition of workbook and this year's new edition science workbook, there are certain questions which are added and new questions are there. So those questions were missed out, but don't worry. After the completion of this lesson, first we will discuss the remaining questions of lesson number 1 and then we will start with the workbook exercise of this lesson number 2. So let's start with the lesson Health and Diseases. In this lesson, students, we are going to study about the health. What is health? What are the different types of diseases? We are also going to study about the symptoms and reasons as well as the preventive measures and treatments of the diseases. So let's start with the lesson. First topic is health. What is health? We just say that physically we are well and that means we are in a good health. But it is not only physical health, it is the balance between the physical, mental and the social well-being, and not only the absence of disease. That is, if any disease is not there, that doesn't mean we are healthy. We have to have a healthy physical, mental and social state. Then we are called as healthy. Second is, what is a disease? The word disease is made up of two words. Dis means not and ease means comfort. When we are not at comfort with our body, it is called as a disease. So it is a condition when there is any disturbance in our physiological or psychological process inside our body, and each and every disease has some specific symptoms because of which the disease can be diagnosed. Then we have to study about the different types of diseases. The diseases are divided into two types. First, on the basis of the duration, for how long they last, and second one is on the basis of the reasons, how the diseases they get infected. We get infected with these diseases. What are the reasons? So first is according to duration. According to duration, the diseases are of two types: chronic diseases and acute diseases. Chronic diseases means which are there for a short period of time, and acute diseases means which remain in our body for a very long duration. So these are the two types of diseases on the basis of their duration. Second one is according to reasons. Now, according to reasons, the diseases are divided again into two groups: hereditary diseases and acquired diseases. Hereditary diseases means the diseases which the person acquire or the person gets inherited from the parents, which are there in the genes. Such diseases are called as hereditary diseases, like Down syndrome. It is a hereditary disease. The other one is acquired diseases. The diseases which we acquire or which we get are called as acquired diseases. And again, these acquired diseases are of two types. First one is infectious diseases and the second one is non-infectious diseases. Infectious diseases means the diseases which spread through contaminated air, contaminated water, contaminated food or vectors. which can be animals, which can be insects, which can be microorganisms. So such diseases which are spread through contaminated air, water and food are called as infectious diseases. Second one is non-infectious diseases. The diseases which do not occur through infections and body contacts are called as non-infectious diseases. These diseases, non-infectious diseases, they arise in human body due to certain reasons. Okay, so these are the different types of diseases. As you can see, students, there is a big chart on the screen which is given in your textbook. In this chart, the name of the diseases are given. The pathogen. Pathogen means the organism which causes the disease, mode of infection, how the infection takes place, what are the symptoms, and how the disease can be prevented and what treatment can be given. So the first one is tuberculosis, which is also called as TB. And as you know, as soon as a child is born, every newborn is given the vaccination of TB on the very first day immediately after the birth. It spreads through Mycobacterium tuberculei, and mode of infection is sputum of patient, which is through air, or if any healthy person remains in a prolonged contact with the patient, can also get the disease. The symptoms are cough, severe cough. There may be sputum, bloody sputum, and difficulty in breathing. And prevention and treatment, as I said, BCG vaccine is given, that is for tuberculosis. Patient should be kept isolated and the regular medication should be given. Second one is hepatitis or jaundice. Hepatitis virus is the pathogen and it is of 4 types, A, B, C and D, and this spreads through contaminated water or sharing of needles or through blood transfusion. And the main symptom is the color of the urine is yellow in the patient. There is weakness and a feeling of nausea, that is vomiting. And prevention is one has to take boiled water and hygiene should be maintained. Third one is dysentery, that is loose motions, and it spreads through so many bacterias like Shigella bacilli and Entamoeba histolytica. It can also spread through the virus. This also spreads through the contaminated food and water. See, whichever diseases spread through contaminated water and food, the prevention and treatment includes the drinking of boiled water and proper hygiene. These are the preventive measures. So in dysentery, as it is loose motion, so the symptoms are watery stool. Sometimes if it is very severe, then the blood is also seen in the stool, because of which the abdomen pain is there. Then next is cholera, which spreads through Vibrio cholerae. Again, the mode of infection is same, contaminated food and water. So all these diseases which spread through contaminated food and water, they have an adverse effect on our alimentary canal. Thus, the symptoms are almost the same: vomiting, diarrhea, and due to weakness there may be cramps in the legs. And the preventive treatment is same, that boiled water should be drunk, proper hygiene should be maintained, open food should be avoided, vaccination can be taken against cholera. And the last one is typhoid, which spreads through the bacterium Salmonella typhi. It also spreads through contaminated food and water. And here also the patient feels very weak due to dehydration. Headache is there. Sometimes there are rashes on the body, dysentery or loose motion, and fever rises up to 104 degree Fahrenheit. The preventive measures are same. One should drink clean water, boiled water, vaccination should be given, and the disposal of sewage should be done very, very carefully. So these were all the different diseases, the infectious diseases, pathogens, mode of infection, symptoms, and prevention and treatment. Everything is given in this table. Then next we have to study about some important diseases of present days. Now the very first one is dengue. Dengue is a fever and it spreads by the Aedes aegypti, and it is caused by a flavivirus which is called as capital DEN, DEN 1, 2 type. These are the different types of the virus. Then what are the symptoms of this disease? The symptoms, the person has very high fever, headache is there, vomiting is there. Now headache generally takes place due to dehydration, which is caused because of the vomiting. Because when a person vomits, the water content becomes less in the body. And because of this dehydration, the pains are there in the eye socket. Eye socket is the bony structure in which the eyes are present. Then decrease in platelet count, and sometimes the internal hemorrhage is there. That is, the blood hemorrhage takes place inside the body, and the platelet, which is corpuscle in the blood, the number of these platelets becomes less. Next is swine flu. Now swine flu, this occurs generally through pigs and humans. Now the virus of swine flu are spread through the sweat and secretions of the patient. The secretion can be from nose, from throat, then through the saliva. And the symptoms of swine flu is the person feels difficulty in breathing, the throat gets sore, there is irritation in the throat, and the whole body ache takes place. So these are the symptoms of swine flu. Then this is just for your knowledge, how to diagnose the swine flu. Now for the diagnosis, the saliva or the liquid from the throat of the patient is sent in the pathological laboratory, and then it is diagnosed on the basis of the report whether the person is suffering from swine flu or not. There are different pathological labs like National Institute of Virology, Pune, and National Institute of Communicable Diseases, NIC, in Delhi. The next is AIDS. The full form of AIDS is Acquired Immunodeficiency Syndrome, and it spreads by the virus HIV, and the full form of HIV is Human Immunodeficiency Virus. Now in this disease, actually what happens, the person's immunity becomes very low and he gets all the infections, all the different diseases. That is why it is called as Human Immunodeficiency Virus. And it is diagnosed by the test which is called as ELISA. It is the proper test for the diagnosis. And the symptoms of AIDS are very specific. The AIDS, actually there is a misconception, there was, I should say, misconception that it spreads through touching and sharing the food with a AIDS infected person, but it's wrong. Our behavior with the patient should be very, very normal, because it does not spread by touching or hugging the person. or sharing the food, but there are other reasons through which the HIV occurs. Then infection through animals. The next type of diseases which we are going to study, they spread through the animals. Now first one is rabies. Rabies is a viral disease, that is, it spreads through the virus, and it occurs due to the bite of infected dog or rabbit or monkey or cat. And hydrophobia is one of the important symptom of this rabies. Hydrophobia. Hydro means water and phobia is fear. The person is very scared of water. That is called as hydrophobia. And the symptoms are, the patient has fever for 2 to 12 weeks. That is around 3 months. Right? Then the behavioral pattern changes. He becomes very exaggerated in his behavior. And as I said, hydrophobia, that is fear for water, is the main symptom of rabies. The next we are going to study is some non-infectious diseases. As I said, the diseases which do not occur through infections or coming in contact with the patient are called as non-infectious diseases. These diseases takes place due to certain abnormalities inside the human body. There are certain reasons due to which the diseases take place inside the body. The very first one is cancer. Now, cancer is nothing but the uncontrolled and abnormal cell growth. The lumps of cells are formed, which are called as ulcers. So, the group or lump of the cancerous cell is called as malignant tumor. The lump of cell, because the control is not there on the multiplication of the cell, and thus the lump or the tumor takes place. Now this tumor can be of two types, benign tumor and malignant tumor. Malignant tumor is actually the cancerous tumor, whereas benign tumor is not harmful. So it can occur in any of the organs like lung cancer, mouth cancer, tongue cancer, stomach cancer, breast cancer, uterus cancer, or the skin or tissues cancer, right? So this abnormal and uncontrolled growth of tumor can take place in any of the organ of our body. Then what about the symptoms? The symptoms are, the patient has a chronic cough, severe cough. The voice changes. Like when we have cold and cough, our voice changes, it becomes hoarse. And due to the irritation and infection in the throat, the swallowing of the food, even the water swallowing, becomes very, very difficult. Then the scars appear on the body which are not curable, and inflammation, that is swelling, also takes place. Then at times the lumps or tumors can be seen in the breast, and the weight loss takes place. There is no reason, suddenly the weight loss takes place. So these are the symptoms of cancer, which is malignant tumor. Second one is diabetes. Diabetes, is a disease which has become very, very common nowadays. Now, the hormone insulin is there in our body, which is produced in the pancreas. And this insulin, it controls the level of sugar, that is glucose, in our blood. And in diabetes, the secretion of insulin is very less, and thus the glucose or the sugar level in our blood increases. and thus the disease called is diabetes. The symptoms of diabetes are frequent urination at night. Every now and then the person goes for urination. Obesity, that is the increase in the body weight, fat, or the weight loss. Either the weight increase takes place or the weight loss takes place. And the reasons for the diabetes can be hereditary. This can be a hereditary disease also. If the parents are suffering, then definitely the children are going to get the diabetes. It can be obesity. If the person is very obese, the person may get the disease diabetes. If a person is doing a sedentary job and not doing physical exercise at all, then also he or she can suffer from diabetes. And mental stress is also one of the reason for the diabetes. The third one is heart disease. Now, when the efficiency of working of heart decreases, it can be decreased due to the less blood supply. When less blood supply is there, that means the less oxygen and nutrient is supplied to the heart muscles. And because of this, the heart has to perform more work. So it is under pressure, which leads to stress. And this may cause an heart attack. If someone gets the heart attack, immediately the doctor should be consulted and the treatment should be started. The reasons for heart attack can be any of the vices like smoking, alcoholism, then diabetes is also one of the reason, then hypertension if the person is having very high BP, then obesity. Again, see, it is said that obesity is an open invitation for number of diseases, right? Then, as I said, the lack of physical exercise, if the person is doing lot of sedentary work, it can be hereditary. Then it can be due to the mental stress or anger. These are all the reasons for the heart attack. And the symptoms of heart diseases are chest pains. As we know that heart is present in the chest region. So the chest pain and uneasiness, breathing problem can be there. And generally in the left shoulder or neck and arms, cramps in the hand can also take place. So these are all the symptoms of heart disease. The next topic is treatment of heart diseases. As per the disease, as per the reason of heart attack, there are different types of treatments available for heart diseases. So the very first treatment is angioplasty. Now angioplasty, students, it is a procedure which is used to open up the blocked coronary arteries which are caused by the coronary artery disease. The coronary arteries, they are blocked and does not allow the blood flow, and thus angioplasty is a procedure where these coronary arteries are open and they again restore the blood flow to the heart. And it is without open heart surgery, that it can be done in an emergency when a person gets the heart attack. The second one is bypass surgery. Bypass surgery is a procedure in which the flow of blood is restored to the muscles of the heart by diverting the flow of blood. It is a bit complicated procedure and it again allows the blood to flow to the heart muscles. The next is open heart surgery. Open heart surgery is very simple, which means that the doctor cuts the chest and open the chest to reach the heart, and then the surgery is performed on the heart. So this is called as open heart surgery. The next is installation of pacemaker. Now pacemaker is a very small machine. It is an electronic device which is implanted, which is placed inside the chest, and it is just below the collarbone to help the regulation of the heartbeat. Now it regulates the heartbeat. And what is heartbeat? Heartbeat is nothing but the flow of blood from the heart. So if the heartbeat goes very low, then the installation of pacemaker is done. Now in this installation of pacemaker, a very small incision is done just below the collarbone in the upper chest, and then the pacemaker, that instrument, that electrical device is fit in that part of the body, and then it is inserted beneath the skin. So this is how the pacemaker is installed in the body. Next is installation of stents. Now in this, the doctor cuts the blood vessel either in the thigh region, in the arm region, or in the neck region, and then a very thin tube which is called a catheter. It is inserted inside the blood vessel, which is blocked. And this tube, this catheter, it has a balloon at the other end. Now when the doctor inflates the balloon, the blockage of the artery is open, right? So this is called as stent. And the last one is heart transplant. You might have studied about the organ transplant. So like any other part of the body, any other organ of the body, the heart can also be transplanted. So it is a surgery in which the deceased heart of the patient is removed and a healthy heart from the donor person is transplanted in the patient's body. So these are the different types of treatments of the heart diseases. Now students, we all should be aware of the first aid in case of any heart attack or in any heart disease. The very first thing, if anyone suffers from heart disease, the very first thing is that the ambulance should be called, and then the patient should be brought back to consciousness by shaking the shoulder. When we are shaking the shoulder, the heart is also shaken, and the patient should be allowed to lie on his back in horizontal position on a hard surface, and the compression only life support should be performed. Now what is COLS, that is compression only life support? Now in this, the center of the thorax, for at least 30 times at the rate of 100 to 120 strokes per minute, the pressure should be applied in the center of the thorax. You might have seen this in the movies or in the serials. When a person suffers from any heart disease or heart attack, the pressure is applied on the thorax, and there are chances of survival of the patient. So students, these are all the treatment of the heart diseases. So students, it is almost time up. A small part of the lesson is remaining, which we will continue in the next period. And students, there is a humble request that please be ready with your workbook and textbook in the next science period, because we will be finishing the lesson in first few minutes of the period, and then I will give you the remaining questions of lesson number 1 which were not given in the workbook exercise. As I told you that I was having the old edition, and now I have got the new edition, this year's edition of the workbook. So whichever questions are remaining, those question and answers we will discuss in the next period. So students, please take care of you and your family and stay home, stay safe. Thank you so much.